Our third option is to have another birth in the hospital with a certified nurse midwife that attended Alice's birth. The biggest pro is the relationship we have with our midwife. Like I said, I was with her through the whole pregnancy with Alice and her birth, and I know the kind of calming presence that she had during the birth itself. She's who I saw when we had our miscarriage, and she's been with me through this pregnancy so far. We definitely both really trust her judgment. She's not someone to cut corners. And we just like her as a person. So overall, we feel really strong about her as a person. We keep saying I wish that she would just do a home birth. Also, the hospital itself is relatively good. If the national rate of C-sections is like 30%, theirs is 11%. It's much lower, much higher rates of breastfeeding among the sort of natural birth community here. This is considered like the hospital to go to. It's the only one that has midwives on staff to deliver babies. We had a pretty positive experience there last time with a couple of issues, but in the 2 years between, the hospital has actually gone through kind of a transformation to become more mother-baby friendly and more progressive that way. Like the two other options, it would be okay to have Alice with us and keep our family together. The reason that's important to me, I don't think I've mentioned, is that first of all, we don't have any family where we live. We don't have any close family that are going to be here with us. So we don't have someone we really, trust and that Alice really knows well to be with during that time. We have a couple of friends that could babysit, but I'm uncomfortable with them babysitting indefinitely. Alice has never been away from me for more than a few hours, and I don't feel like the time to start is, at the exact moment that I'm bringing her a new sibling, and that's totally going to rock her world anyway. It's just my preference, my parenting style. I would just prefer to keep us together. So in theory, we can do that at the hospital. Cost-wise, this would probably be mid-range between the other two, based on how much we paid for Alice's birth and what our insurance coverage was like. If everything goes normally and there's no special treatment involved, we would probably pay double what we would at the birth center and half of what we would for home birth. Mike is probably most comfortable with the hospital just because of all those sort of worst case scenarios. If we needed any emergency services, they would be right there. And there actually aren't a whole lot of curveballs that could come up in the pregnancy that would necessitate us transferring out of our midwife's care. She can deal with group B strep, she can deal with gestational diabetes, she can deal with hypertension. If the baby is breech or if the baby is preterm, then she will still attend our birth. She'll just team up with her backup OB. But she'll still be there for us and we'll still have that connection. If we decide to plan a hospital birth, we will most likely hire a doula that we know and like. I think she would be really helpful with supporting me if Mike is attending to Alice or Mike is, focused on Alice. Also, she would just be able to help us, at home, leading up to labor and in early labor, and then in postpartum. I think that just sort of in general having an extra set of hands would be a nice thing. I've never heard anyone say, oh, I had a great birth except for that doula, I think she would just be a great person to have around and would probably make our hospital experience even more positive. So for the cons, we would have to transfer from home to the hospital, and that was something that in Alice's labor, I found pretty disruptive. My labor kind of stalled out, the baby turned, and then from that time she was face up, and I had back labor, and it was just, it was sort of a disruptive thing. At the hospital, we would just be assigned, the nurse that is on shift, so it wouldn't be somebody we would know ahead of time or have any choice in, so she or he might be helpful or not. There would also be certain rules that we would have to follow, just because of hospital policy. Our midwife was really good last time at minimizing the impact of those kind of things on us and really sort of advocating for what we wanted in our birth plan, but it's still a medical environment. It's still a place where everybody is used to doing things a certain way, and it can be hard to kind of rock the boat in the midst of things. Also, I guess just personally, my personal philosophy is that uncomplicated births are just a sort of normal life event, not necessarily a medical event, so I don't really feel like you need to be in a medical environment in most cases, personally. I know being in the hospital makes interventions more likely, and of course having a strong advocate like I think our midwife is does help with that. One of those rules that we could not work around would be that they don't do any sort of water birth or laboring in water. There are showers, but there are no tubs. That's really something I want to experience, and if this is my last birth, this may be my only chance to get that, and that's not an option at the hospital. Another one of those rules is that in the hospital, if I do test positive for group B strep, then I would get the conventional antibiotic treatment, according to their protocol. I did receive that during Alice's birth on the right schedule and everything. I believe I got 3 doses over the course of 12 hours. But some group B strep is antibiotic resistant. So evidently in my case, it didn't work. And Alice still got sick, and then we dealt with 2 years of thrush with breastfeeding. So I definitely have concerns about, the effectiveness of that course of treatment again. Of course, if I'm negative, it's a non-issue, but still it's in the back of my mind. I also have concerns about Alice's comfort in that kind of environment, just being out of her space and in a strange place for, possibly a long time. I imagine that I would have to at least spend one overnight without Mike and Alice if, Mike took her home to go to sleep, which is far from ideal for me. Overall, this isn't a bad option. There are some really strong reasons to choose this hospital and this midwife, but there are also some compromises we would make in that case. So this is an option we are still considering, and now comes the hard work of trying to flesh out how we really feel and how we want to proceed.